Good. Thank you very much for you to come to today's talk. So this is actually our second last talk. We still have one more talk on December 11, 10 a.m. Central Time. So today we have two speakers, and yes, I'm looking forward to introduce them. And okay, our first speaker is Dr. Yuhao Kang, and Dr. Kang directs the Geospatial Intelligent Sensing and Mapping GISense lab at UT Austin. So the lab is focused on modeling and understanding human-environment relationship at space and place and tackling real-world challenges, including spatial social inequality, public health, housing, crime, also in urban system with spatial temporal big data analytics, geospatial artificial intelligence called GeoAI, and maps and geovisualizations. As the director of the lab, Dr. Kang has published over 50 peer-reviewed articles on prestigious journals such as International Journal of Geographical Information Science and Proceedings of National Academy of Science. Yes, he has served as associate editor of Computational Urban Science, editorial board member of Humanities and Social Science Communications, and also has a reviewer of over 50 academic journals such as Nature Communication and Nature Human Behavior. Okay, before Dr. Khan start, like I would encourage everyone, if you have any questions, you can type them in the chat box and we will try to get to them after our presenter finish their presenting. And you can also wait until the end of the presentation and then we actually have around 5 to 10 minutes for you to ask more questions. So now let's go to Dr. Khan's presentation.
Yeah, thank you, Dr. Ting, for your kind introduction. Hi, everyone. I'm Yuhao Kang. I'm currently an assistant professor at the Department of Geography and the Environment. As Dr. Ding mentioned, I'm a geographer and I work on addressing some health-related issues such as the disparity, how can we improve the overall equity of maternity care. So today my presentation is entitled Equitable Motherhood, Healthcare Resource Allocation Using Reinforcement Learning, which is a cutting-edge AI algorithm. So what is equitable motherhood? What is equitable motherhood? Or what is inequitable motherhood? So we all know that across the entire United States, there are significant inequality in healthcare care accessibility, which indicate whether it is feasible, whether it is convenient for you to visit certain health facilities. We all know that there has been significant health disparities across the entire nation, right? So because of this, they also lead to some negative health outcomes. For instance, previous studies have identified that residents in rural counties experience much higher mortality rates compared to their urban counterparts. So as you can see, different regions are facing different disparity in access to care. In particularly, in maternity care, we also observe such kind of disparities. So let me ask you this question. Can we reduce disparity in access to improve maternity care and enhance equitable motherhood? So in other words, after we have identified such kind of disparity in access to maternity care, how can we have some actionable interventions to enhance the overall access to the maternity care? So because of this question, our team recently proposed a potential solution. First, we would like to identify regions that need additional healthcare resources. In other words, we would like to identify those underserved regions that need interventions. Second, after we identify those underserved regions, can we spend more investments? Can we spend more resources to reallocate different types of healthcare resources to improve the maternity care access. In this case, we propose to use a cutting-edge AI algorithm supported by reinforcement learning. So the intuition, the idea is very intuitive. As you can see, assume we have different hospitals in different regions. In some regions, like these two hospitals, they locate in regions with sufficient healthcare resources. They have already received a lot of healthcare resources, but there is another hospital located in another region with limited healthcare resources. So is it possible that we improve or optimize the healthcare resources to improve the overall access to maternity care? If we can, for instance, reallocate some of the healthcare resources from those resourceful regions and then to the underserved regions, then probably we could enhance the access to those underserved regions. And here, when we talk about the healthcare resources, it can be different forms, such as number of professionals, number of beds, number of ICUs, or vaccines during the COVID-19, etc. Well, in our case, we are focusing on the maternity data, so we are curious whether we can reallocate the workforce or even suggest funding reallocation to support those regions with limited access to maternity care. Yeah, as you can see, if we can do so, then probably we can reallocate some healthcare resources from those resourceful regions to those regions underserved, which can enhance and reduce the disparity in access to maternity care. And to do so, we leverage a cutting-edge AI algorithm called reinforcement learning. In 2014, Google developed the AlphaGo, which beats the championship, the world champion in Go, which is a chess similar to chess game, and it is supported by reinforcement learning. Reinforcement learning is a type of AI where an agent learns to make decisions by interacting with its environment and receiving feedback based on the outcomes of those decisions. So in our product, we try to leverage reinforcement learning to reallocate different healthcare resources, such as the workforce, to enhance the access to maternity care. So here is the principle of our reinforcement learning. Reinforcement learning has three important components, including the environment, like the spatial distribution of maternity care systems, and their healthcare resources. And the second, agent. Here, agent can reallocate healthcare resources from resourceful regions to underserved regions. And finally, we also need to define an objective of the reinforcement learning, which means we want to reduce the overall variance of accessibility to maternity care facilities. So as you can see on the left, we try to allocate some doctors or some workforce from certain hospitals to underserved regions. After we reallocate such kind of workforce, probably we can enhance the overall accuracy, the overall access to maternity care. And to develop such a reinforcement learning, we first collect the data in Florida. By collaborating with my collaborators in South Carolina, we recently retrieved the over 1.5 million birth certificates in Florida from 2016. And we also retrieved the hospital information. As you can see, we retrieved the number of obstetric professionals and beds in each hospital. Based on the individual hospital utilization data, we create a map on the right to indicate the total number of births and the obstetric units in each hospital across the entire Florida. And we also show the flows. As you can see, like patients usually visit their nearby hospitals to deliver the new babies, but we can also observe some long distance travels. So after we quantify the maternity care resource distribution, we develop an accessibility index in Florida using the birth delivery data to identify those resourceful or underserved regions. So here are the two maps that we created based on our data. As you can see, for those regions in dark blue, they indicate those regions have enough or have sufficient healthcare resources. Well, for those regions like in light, it indicates those regions, including zip codes as well as counties, that they do not receive sufficient healthcare resources. So by doing so, by developing such a 2SFCA accessibility index, we can identify which regions are resourceful and which regions are underserved regions. So based on this accessibility index, we further developed this reinforcement learning. And here, the environment refers to supply and demand. The supply refers to the healthcare resources, such as hospitals, number of obstetric units, and the demand refers to the accessibility scores of each county and each zip code. And the action here is we have one agent which can reallocate different workforce across different hospitals. And the objective in our reinforcement learning is we try to decrease the accessibility variance. In other words, we want to reduce the disparity in access to maternity care. And also we hope to increase the overall average accessibility across the entire study area. In other words, if we leverage these reinforcement learning algorithms, it can generate different simulations. And if we follow such kind of simulations, we can reduce the health disparity, but also increase the overall accessibility to maternity care facilities. And after collaborating with health professionals, maternity care health professionals, we developed the following three scenarios, which we can simulate using our reinforcement learning to simulate the reallocation of healthcare resources, including minimizing the distance, preserving the resources, and targeting underserved regions. For the first one, as you can imagine, when we reallocate healthcare workforce, people prefer to, for instance, to be reallocated or to work in a nearby regions rather than a region that is far away from your previous region. For instance, when we conduct the reallocation, if you work in Austin, definitely you probably don't want to be reallocated to New York, but you probably is okay to work in Round Rock, which is not far away from your existing region, right? The third one is to targeting underserved regions, because when we develop the reinforcement learning, we also hope it can have some customization or adjustment to prioritize certain communities to have more investment on healthcare resources for that kind of specific underserved communities. So by accounting for these three real-world scenarios, we also account for them into the reinforcement learning algorithm design. So here are the results. The first one, we want to reduce the distance for reallocating of the workforce. And as you can see, our algorithm could reduce the overall distance. The second one refers to the retention percentage by models. So by adjusting this, we can ensure that certain hospitals can still have certain number of healthcare resources. And the last one is we also try to prioritize certain counties, certain underserved regions. For instance, based on our accessibility index, we identify that Baker County, Calhoun County, and Holmes County. So these three counties, they face more challenges in accessing to the maternity care regions. Then in this case, we also account for this in our reinforcement learning to prioritize the reallocation. In other words, these three counties could receive more healthcare resources. Following our simulations. And here are the simulation results. I just provide an example to demonstrate what we can generate. So our reinforcement learning algorithm could account for those different scenarios I just mentioned to reallocate different workforce across different regions, following different scenarios. As you can see, like scenario 1, scenario 2, and scenario 3 to prioritize certain counties. And at the beginning, the access to maternity care, yeah, the standard deviation or the variance is 4.32. But after we reallocate such kind of workforce, as you can see, their accessibility variance decrease from 4.32 to 2 to around 2 to around 2. Then in this case, it indicates if policy decision makers following our suggestions in different scenarios, then we can reallocate certain healthcare resources and the maternity care access standard deviation can be reduced significantly. And also we still increase or keep the average accessibility at a similar level, So in this case, if we use reinforcement learning to reallocate healthcare resources, especially the maternity care resources, we probably can reduce the disparity in access to maternity care facilities and also improve the overall access to maternity care. And on the left, we show like which regions we should probably increase the hospitals, probably increase the workforce, or should receive more resources. So that's the general idea. And in this case, if we provide such kind of simulation results, it may provide data-driven, or evidence to support the further policy decision making to identify which regions, where, and how much resources should we spend. And as you can see, the current setting was in Florida. The reason is I had my collaborators working in Florida, and we got the accessibility, we got the individual birth certificates in Florida. And I'm lucky that here at UT Austin, I also recently built collaborations with Dr. Laurie Harper and Dr. Raj Reddy. We recently retrieved over 2.5 million birth certificates in Texas from 2016 to 2023. We also retrieved the number of obstetric professionals and beds in hospitals. So we have already created a few preliminary maps to showcase the spatial distributions of such health resources as well as the accessibility index. So we hope that our next step is we hope to integrate reinforcement learning to provide some simulations in our Texas context and to inform the further policy decision making. So to summarize, first, we provide a cutting-edge AI algorithm, which is reinforcement learning, which may provide novel solutions for reducing inequality of access to maternal healthcare facilities. And second, it's also necessary to conduct a multidisciplinary research to translate AI to benefit real-world practices. Although I have expertise in AI, but I would like to thank for all my collaborators, like my collaborator Pei Yin Hong and Dr. Laurie Harper and Raj Radish. They all have health domain knowledge, which are necessary to help me guide my development of the AI algorithm. And more domain knowledge in public health and policy are needed to guide the future development of AI to ensure it indeed serve for the needs of health professionals and health systems. Okay, I think that's all for my presentation. Thank you for attending, and I'm happy to further having conversations with you. Yeah.
Great. Thank you very much for the very informative, insightful presentation. We do have a couple of minutes for questions. Any questions? Feel free to, speak out if, ask questions.
Brian, you had your hand raised. I think we can.
Okay.
Yes.
Thank you, Dr. Kang, for the presentation. I was thinking about the sort of real world implementation of some of these findings, and I was wondering if, with that in mind, you modeled for any of the scenarios, like how long it would take for these for these different scenarios to be implemented, in terms of like moving providers around or things like that. Is there any idea of the sort of time to implementation to realize these scenarios for providers and patients and things like that?
Oh, yeah, thanks for the question. I think one advantage of reinforcement learning compared with traditional statistical modeling is it is relatively more efficient and it can converge or it can generate some results within a few hours rather than like for mathematical modeling, sometimes the model doesn't converge. And regarding the real world implications, yes, that's something I'm here and I look forward to potential collaborations to talk with different stakeholders to seek for potential collaborations. Here, we can provide a map like this, and we can also showcase like how many, if we follow a specific scenario, how the accessibility will change, right? And it might be benefit for different downstream or implementations like the workforce planning, or we can also suggest funding. For instance, for certain regions, how many funding should we investigate, should we spend to support certain underserved regions? Or it's possible to like link to insurance companies, like for instance, how to better estimate the insurance rates, or probably related to Medicaid systems if the outcomes like this are useful. So far, we have developed such a pilot proof of concept reinforcement learning algorithm, and I look forward to potential collaborations from different fields. If you think this can really benefit your real world implications or real world implementations, I'm open for conversation. Yeah.
Thank you.
Yeah, great. Catherine?
Thank you, Dr. Kang, for this presentation. It's super interesting. I'm curious, kind of along the same lines, if you were able to, if the AI model was able to account for like different health systems. So, for example, here in Austin, maybe Ascension or St. David's are very well resourced, they're over resourced, but you go to a rural area that's maybe less resourced, but it's a different hospital system. I could see this working really well in a place, where maybe you have like an NHS or a nationalized healthcare system and you're able to move people around because they all work for the same people. I'm just curious if you were able to incorporate the ability to kind of differentiate between systems and, I could just see that being a little bit of a barrier. And so that was just a curious real world question I kind of had.
Yeah, lovely. Thanks for raising this question. I totally agree with you, and I think that's one reason we use reinforcement learning. One advantage of reinforcement learning because it can account for many different real world scenarios, like the insurance network or the hospital network. They are all possible to be integrated into the reinforcement learning algorithm. Yeah. And that's why I also want more collaborations or receive more knowledge from health professionals. Thanks for pointing that out. And I think we should co-design such kind of scenarios. The existing scenarios is already like supported by my collaborators in working in health. But we are also happy to see potential future scenarios. So this is just a start. But in the future, yeah, definitely through potential new scenarios, and it's possible to integrate that into our reinforcement learning. It's very flexible and it can account for many real-world scenarios. However, for me, as an AI expert, I probably don't know what kind of scenarios. So that's why we need interdisciplinary collaborations.
Great. That's precisely our talk series. Try to, introduce each other and, maybe you find future collaborators in this, talk audience. For now, I want to transit to a next talk. So I'm very happy to introduce my new colleague, Dr. Ryan Mall, and he's an assistant professor in School of Information at UT Austin. His research examines media and technology use across the lifespan, especially focused on older adults. He's interested in identifying how individuals, especially old adults, can effectively use media and technology to pursue everyday goals, as well as understanding ways to help build resilience to threats such as online scam and other forms of deception. So Dr. Mao used a variety of methodologies in his work, including large-scale digital trace data, online and lab experiments, surveys, content analysis, computational linguistics. Before joining UT, he earned a PhD from Stanford University, where he was a member of the Stanford Social Media and Lifespan Development Labs. He also spent a year at Stanford Center on Longevity. And ladies and gentlemen, no, actually, he spent a year at the Stanford Center on Longevity. And so now let's welcome Ran to give his talk.
Thank you so much, Ying, for the gracious introduction. I'm really appreciative to have been invited to speak at this series. I'm going to talk about some of my established and most recent and future work in this topic of aging and digital deception. And for this presentation, given the time constraints, I chose to kind of go breadth over depth. So I'm going to talk about several different things and be kind of light on the methods, but if folks have questions, I'm happy to chat more after my presentation or after the session. So one challenge that I've identified in my research is that older adults are outsized targets of digital deception. And this is true across several different domains. And we'll talk about a couple. And this is important because it could spell consequences for personal and public health, for financial security, and for democracy. One of these forms of digital deception are what we call untrustworthy websites. So these are websites that repeatedly publish false content, and that judgment is typically made by professional editors or journalists or other experts that kind of evaluate websites. And I want to talk about a finding from this Nature Human Behavior paper that I led a few years ago, in which we looked at exposure to untrustworthy websites during the 2020 election in the United States. This paper draws on web browsing data, so participants install software on their personal devices, and it logs the different domains that they visit. And so in this paper, we look at the 2020 election as well as draw on data from the 2016 election, and we look at 10 weeks of web browsing data across those two time points from over 3,500 American adults. And so what we can look at is the percentage of Americans that are exposed to untrustworthy websites there on the y-axis in each of these different age groups along the x-axis, ranging from under 30 to over 65. And what you can see in both 2016 and 2020 is that older adults were more likely than other age groups, especially those under 30, to be exposed to untrustworthy websites. And while we see in 2020 that exposure in all age groups fell, this sort of age-related pattern persisted. And the difference between the over 65 and the under 30 actually grew a little bit larger. There are lots of possible reasons as to why this might be the case. Almost certainly one of them has to do with targeting. Older adults may be targeted by this type of content to exploit their financial resources, their health-related needs and concerns, or their political importance. Older adults vote at much higher rates than younger people. But nevertheless, this has been shown in a variety of studies looking at different online platforms and is pretty robust. And a sneak peek, we have a paper under review right now using the similar approach looking at the 2024 election. We were especially interested in exposure to AI-generated untrustworthy content, and we still find that this age pattern persisted in 2024. The good news is that my work suggests that brief digital literacy interventions can build older adults' resilience to digital deception. And I'm going to talk about some recent work that focused on short educational videos that had the goal of improving older adults' digital literacy. So this is a project that I did in collaboration with a nonprofit partner, MediaWise, their media literacy organization, as well as Jigsaw, which is part of Google. In this project, we developed 6 different videos, all under a minute. So we had 15-second videos and 45-second videos, and we taught different digital literacy skills, lateral reading, which I'm going to show an example of in a moment, as well as things like reverse image search. So here's a sense of what we developed and studied in this project.
Look at the monster pepper this farmer picked. Looks like he grew it for charity. Open some browser tabs and search on giant jalapeno charity, nonprofit. Check multiple credible sources. That's called lateral reading. The news says the charity's a scam.
So this is really fast, right? It's trying to introduce the idea of lateral reading, show an example of how you might practice it on a smartphone applied to this charity scam, and kind of situate it in sort of what we thought might be an entertaining vignette. I had done previous work on other forms of digital literacy education, these longer online classes or these long text message based courses. But we really wanted to see if we could deliver meaningful educational content for older adults in this really short modality. Now, in the study, we examined the efficacy of these videos in multiple experiments. We measure a lot of things in surveys, like people's ability to distinguish between credible and untrustworthy social media posts and their ability to answer comprehension questions about the skills. But I'm going to focus in on two pieces of data from this large project to talk about in terms of results. And I'm really excited about these because these have not really been explored before as it relates to digital literacy interventions in general, and especially with respect to digital literacy interventions for older adults. And that's effects of these videos on people's real online behaviors. So similar to the untrustworthy website study I talked about earlier, we had some participants install software that logged the domains that they visited as they went about their lives and used their devices. And what we can do is we can look at the effect of being shown one of these short, less than 1 minute videos once on people's use of the skill that they learned in their everyday web browsing activity. And that's what we see here. So we have the different skills that were taught, and we basically operationalize these by looking for behavioral traces of people using these skills in their browsing. So for reverse image search, people visiting reverse image search domains is evidence of them doing reverse image search. For lateral reading, we look for instances where people are on news or information articles, and then the next visit is conducting a search about them. And for reading upstream, which is the idea that when you're reading an article, you can click on the hyperlinks contained within to go read more about original sources. We can look for evidence of people clicking on those hyperlinks in their web browsing data. And so what we find is when we look at these different experimental conditions where people saw these videos compared to a control group who didn't see them, we find that in all the cases, these short videos, just one dose of these videos, increased the likelihood significantly that older adults used these skills in their everyday web browsing to verify information. Now you might say, that's great, people are using these skills, but to what effect? Right? Does it actually translate in them to older adults being exposed to higher quality information? And we can also, and we did, look at that. So we can also look at the effects of the videos on the quality of the domains that people visited. This is kind of what this looks like. We have the browsing data. This is just some examples from some hypothetical participants of sort of what the data looks like. And by matching the websites that our participants visited to a large database of quality scores ranging from 0 to 1 that were curated by House Linen colleagues, we can look at the effects of exposure to these videos on the quality, on the average sort of quality of the websites that older adults visited. And what we find is that in all cases except for the reverse image search video, the exposure to these videos one time significantly increased the average sort of quality of the websites that older adults visited in the 8 weeks or so after. That's how long we tracked the web browsing for. And promisingly, these two things are related. So what we can see is that changes in the use of these skills explained a significant amount of the variance in the improvement in the quality of people's information diets later on. And so what you can take away from this is that these short videos increase older adults' use of these verification and digital literacy skills in their everyday browsing, and that translated to improving the quality of the information that they were exposed to. The last thing I'll talk about with this is we got to test out the effects at scale. So we did a field experiment on YouTube where we took our most successful 15-second and 45-second videos as determined in prior studies and basically ran an experiment where we had older adults in the United States on YouTube who were randomized into groups where they could either see our ad or not see our ad. And we're able to measure comprehension or learning from our ad by using this brand lift sort of infrastructure that YouTube provides for advertisers and sort of hijacking it for our purposes. So here's an example of a screenshot of us asking in the YouTube interface a comprehension question about our lateral reading video. And maybe if you use YouTube, you've seen these kind of multiple choice questions from different advertisers. We use that to ask a comprehension question about our videos. And by comparing older adults that saw our video and answered our question to older adults who didn't see our video and answered the question, we can get an understanding of how effective they were. And so looking at the actual results from this, we delivered over 10 million impressions to older adults in the US in the late 2024 and got far fewer actual responses to our question owing to the high rate of non-response to this sort of thing. What we can look at is the percentage of people in the groups that saw the videos that answered the questions correctly compared to the percentage in the control group that answered the questions correctly. And in both videos, we see that there was a significantly greater number of people, a number of older adults in the exposed group that answered the questions correctly. This averages out across both campaigns to about 3.3%, which if you then extrapolate by the number of impressions, suggested that 300,000 older adults from this campaign successfully learned one of these digital literacy skills that we show in the other studies helps improve the information that they're exposed to. And if you think about it in terms of cost, this cost about 20 cents per lifted or sort of successfully educated user. Okay, I'm going to talk for the last couple minutes about some of my future directions. So first, I'm interested in exploring other channels for deception. One of the things I'm really interested in right now are scam robocalls. I'm sure that almost, if not everyone on this meeting has some experience and maybe frustrations regarding these unwanted calls and texts as well. Research suggests that older adults are specifically targeted by fraud, often because of assumptions about greater financial resources. And this is true in the modality of robocalls specifically. And in terms of robocalls, of the robocall scams that are reported, older adults report the highest median financial losses. So in a new project that I've been working on and is under review with Doug Shadell, who has decades of experience in the fraud prevention space, we've been analyzing robocalls from this honeypot, which is a bunch of phone lines that just receive and record robocalls, but no one's sort of on the other end. There's no human answering them. That's maintained by the commercial organization NomoRobo that makes call blocking software. We analyzed almost 300,000 phone lines over a 5-year period from 2018 to 2022, and they received over 4.5 million robocall pitches because there's no one actually answering on the other end, so they're just pitches. So we analyzed over 4.5 million of these things. I leveraged large language models in order to sort within that 4.5 million between scams, which is what we're interested in, and spam, which is a lot of it, as well as to distinguish between calls that target older adults, think Medicare scams, which are very common, versus scams that are more general and may target the general public. And so just to show a result here, we can look at the differences between scams, robocall scams that target older adults and those that target the general public. And so here we have a number of different tactics that are often used in scams. And we can use dictionaries of words and phrases that previous researchers have developed to identify the presence of these things in scams and put them on our robocall data to see how it compares robocalls that target older adults, robocall scams that target the general public. What we can see is that robocall scams targeting older adults tend to invoke time pressure more and also tend to feature greater language consistent with threats of loss. Now, if we look at the literature, psychology literature, this is concerning because there's evidence that older adults are more likely to make decisions that minimize losses, and also that time pressure inhibits decision-making among older adults. And so these could be vectors of vulnerability that what I'm thinking, in addition to being theoretically interesting, could also be the inputs of interventions that we develop to build older adults' resilience to robocall scams. Let's say that we have 30 seconds of someone's time in an intervention that's reasonably going to be scalable. What should we spend that 30 seconds on? These are some potential ideas. In addition, I'm interested in digging deeper into variation within older adults, in their uses of technologies, the challenges they encounter, and the solutions that we might develop to allow them to use tech to enhance their everyday lives. Often, there are just regression models where a variable's in there for 60 plus or 65 plus, or even like the chart I showed at the beginning of my presentation. And those decisions are made rather arbitrarily. And in fact, that's obscuring a lot of variation within the large and growing older adult population, both in terms of the sociodemographic differences of those older adults, but also just age in and of itself. And older adults, depending on being 65 or 85, may have different experiences with technology in their personal or past professional lives, may have different mental models about how technological systems work. And so I'm really excited to collaborate with the large community of aging researchers here on campus at UT to drill in more granularly into the wide diversity that exists within the population of older adults and understand how that variation bears out in the technology experiences and potentially technology solutions. Of course, I have to talk about AI. The skills that I taught in those videos, for example, the lateral reading, the person does a search and we try to show them that there are sponsored results and we want them to click on the non-sponsored results. But these days, if you did that search, you'd probably get an AI overview before any of that. And when I do most Google searches, an AI overview is the first thing that I see. And so a question I'm wrestling with is, to what extent are some of these digital literacy skills evergreen and still very useful in the Gen AI era? Versus under what conditions or for what purposes do we need to think about new skills and competencies? And how do we think about all of that in the context of older adults specifically and developing education or training resources for that population with regards to AI? And finally, because of the focus in the short time period of this talk, it's sort of focused on challenges older adults face, but there are so many strengths that also come along with aging, especially in the social and emotional realm, that I'd love to understand how to harness in order to empower older adults in using technology to improve their daily lives and succeed in everyday goals and long-term goals. And I think that some of these strengths, like stronger emotion regulation capabilities, could work to improve the information environment for everybody. And I'm really interested in exploring studies that try to understand and harness those strengths as it relates to technology use. I just wanted to thank my co-authors on the work that I talked about, and thank you for your attention. And these are some ways to contact me.
Okay, great talk. Any questions? Catherine? Oh, Catherine is pausing. Okay.
I was just clapping, but it
yeah,
was very
you have a question?
interesting.
Okay.
Yeah, thank you.
Actually, I have a question. So, yeah, I think scamming is really, overwhelming. And especially for old adult. And you propose the lateral reading. Do you think I was thinking about the ChatGPT, this LM actually will actually provide a new way for them to understand the news. For instance, you go to GPT to search, they barely has any scam and they summarize for them. They provide some discussion. Do you think this will help old adult to increase their, yeah, go ahead.
It's such a good and researchable question. As I mentioned, we tell people, open when you're reading information, particularly if you're not sure about its veracity, open new tabs, and you can search for what others say about that information. And that has sort of two benefits. One, it's just creating some friction. Often scams and this type of deceptive content is highly arousing. It gets people emotions or fears ramped up. And so by opening that new tab and leaving that page, that psychologically has a benefit. But the question is, what should people go to for those searches? And even if they do a search on Google, which is what traditionally is taught for lateral reading, it may be more similar to interacting with a chatbot because if the first result that they get is AI overviews. And right now, in a lot of the way that lateral reading is taught, people are taught how to write a good search query, right? Which often in the search engine era doesn't look like writing full sentences and using natural language. But that is the way that people are supposed to be able to interact with AI chatbots. So I think there's tons of questions here. Should people still use search engines, and how do we make them understand that those AI overviews are something a little bit different, and how they should understand those in context with all the other results? Should we suggest that that people go to ChatGPT. I mean, ChatGPT certainly takes a lot of the labor out of, oh wow, I see, 200 pages of 10 results each. Like, how do I know what's high quality? ChatGPT just surfaces some answer for you, which seems like it could be appealing sort of from a user experience perspective, but may not always be accurate, may hallucinate. And if the stakes are high, that could also be something that we would be very worried about. So I think there's a lot of opportunity there and a lot of researchable kind of questions. Thank you, Ying.
Mhm. We do have a question from audience. Kinda, do you want to say your question or I can read your questions?
Sure, I can come on mute. So I was just curious about those short videos that you showed, like the one on lateral reading. Are those videos widely accessible for older adults, or were they sort of limited to your study?
Yeah, thanks for the question. We wanted to obviously understand kind of the science behind if they worked and for whom and how much after we developed them. But we are currently there have been some advertising efforts to continue to increase the distribution of these videos. Given their length and stuff, they're kind of made not with advertising in mind, but they're made at such a duration. For example, a 15-second video, the reason we chose that is because it can be run unskippable on YouTube. And so that was something we were interested in. I don't know if we have a singular landing page with all the videos and resources yet. I think right now the goal has been to get this thing through peer review. But I think once we do, especially given that we worked with these real world partners that have their own large distribution and stakeholders, it'll definitely be a top priority to make that information available in a way that's accessible and hopefully get it in front of as many older adults as we can while continuing to do research on how to make it better and how to account for AI and all these other things. Thanks for the question. I'm happy to
Yeah,
share them with the links with you directly if you'd like right now.
yeah, no, I think that's great. And I think that you can even like prioritize like which sort of platforms and social media platforms the older adults are using. So whether it's like Facebook or if it's
Yeah.
Instagram Reels or
Yeah.
TikTok, you can sort of play around with that. So that's
Yeah, Facebook definitely, based on what I know about the user numbers, is very important for social media for older folks.
thank you.
Stephanie?
Yes, thank you, Dr. Moore. And it was kind of along the lines of what Kendo was just saying. I work in the geriatric space, in the independent living, assisted living, and that. And of course, this is a large problem for them. So where could they get access to this information? And do you ever, go sit, teach, learn, or a team? Do you have a team who goes and does that? Because they are always interested in finding out how to protect themselves. Not only them, but their adult children who put them there are very, very interested in how do I protect mom or
Yeah.
dad or whoever.
Thanks for the questions. I've been so like zeroed in on the scientific publication of this work that I'm realizing that I think the next step will be focusing on scale and the social impact potential that these videos can have and making them accessible widely and targeting like advertising efforts on platforms that older adults use. So thanks for the first part of the question. Regarding the second part, I remember when I started my PhD and I was like, I'm really interested in older adults' use of technology, and there's all these like challenges, and my advisor encouraged me to go to senior centers and just sit down. And there's so often these like technology tutoring programs, classes. Yeah, this is such a common topic, and I learned so much by doing interviews and by just listening to older adults talk about getting their first smartphone or trying to set up a social media profile or trying to manage the 7 email addresses that they have. So that's a really important part of where I get these research questions from and how I, determine what priorities I want to pursue in my work, because I really do want this work to be beneficial to everyday folks in addition to science and the literature and those things. But yeah, I'm excited now that I'm here at UT to start making those connections with organizations like Age of Central Texas and several others in order to potentially identify those sites for learning and for like we develop these videos with older adults getting feedback. And so if I can find opportunities to do that, that would be really important. And I'm happy to give talks in those organizations, disseminate these videos. Yeah, those are really important like partners for me moving forward. And I'm looking forward to developing those relationships and building upon the relationships of others so that I can make sure that I'm doing good work and it has the ability to benefit people here in Austin. Thank you.
Thank you. I think we still have a couple of more minutes. Any questions? I do have one more question. So technology, I know there's them, but old adults, they tend to not really know how to use even mobile phone. They have so yes, so they think best way to reach old adult by phone, by calling them, because even just texting and find the, you know, app or somewhere. So I was thinking about, do you think you can actually, rather than robot call scam, right? Do you think is any way like the campaigns through the call actually teach them? Like I learned a lot for fraud when we go to the employee training, right? Employee training, which like look at email address
Right.
and everything, and those kind of thing, like tell them, or even create an app. I mean, I was thinking about not everywhere, but we can create an app, add these little videos and little something, and use agent to chat with them. And remember each time you look at your email, pay attention to the email address and make sure they are consistent, blah blah, and those kind of like a public campaign for like a spread out, because I know you can give a talk in many center, but that's very limited. It's you can only reach
Yeah.
a limited number of, yeah.
Great questions, Ying, and some great idea. This is a really good idea too. I never thought about using the robocall sort of technique as a way to disseminate education. I'll say two things. One is, it is an important limitation to consider with this work. All these studies, I recruit people online through online panels. And also, we did this big field experiment on YouTube. And so the older adults that I reach are those who are online and probably on the digitally savvier end of the spectrum. And so while these modalities through these delivery channels were effective for some older adults, they probably aren't going to be effective for all older adults and may not be the best way to reach some older adults. So that's something really important to consider. And it's one of the reasons why I'm excited to be able to make connections in the community to study older adults who aren't just the most online, which is what we may be limited to when we do a study on social media or something like that. Regarding the ideas of sharing education through the robocall channel, it's really interesting. It makes me think like some of the advice right now is like ignore calls from unknown numbers or
Yes.
don't trust caller ID. So I wonder if those would be challenges for spreading the good word through robocalls, is that the intervention, like the things we tell people to avoid, would also lead them to avoid education. But that's just an initial reaction. It's a really interesting idea.
Oh, we can set up like hotline, like
Oh
a
yeah, yeah,
99, not 911, but nine something. Like every time they think something suspicious, they don't know whether they should, reply or not.
yeah,
Because this kind of, time pressure and loss, right? They need to have several conversations, not just by one email. They will share their bank account. They need some round of
sure.
email, right? And then they can actually call this line, hey, I actually have this email, but I really suspicious, but it looks so real, but what should I do?
Yeah.
No,
I Going back to your earlier question about
yeah,
using ChatGPT,
yeah,
we did not fine-tune models in order to use the LLM to distinguish scam from spam and all that. We just did simple prompt engineering. So
yeah.
one of the goals that I have for this work is to make the prompt that we develop publicly available. And
Mm-hmm.
so if anybody, older adult or otherwise, gets a voicemail or a text message, they may be able to upload it to GPT in addition to our prompt in order
Mm-hmm.
to receive some kind of validated advice or judgment as to whether that might be a spam or a scam. So that's one way that I hope that even what I've done already can kind of make a contribution there. Because the idea of there being a hotline, that requires a lot of labor and people
Yes.
to have those extensive conversations. So if we could leverage
Hotline can
chatbots.
be answered by agent.
Yeah. And I think some of the prompt engineering that I've done could be some
Yeah.
of the groundwork for making those agents
Prompt,
especially
automatic
good
promptlet.
at
Yeah.
providing advice in this domain. Yeah.
Yes.
Thank you.
Yeah. You're welcome. We have a great discussion for this session. So thank you, everyone. And I will see you next talk, December 11th. Thank you.
Thanks,
Bye.
everyone.
Mhm.
Thank you.